Good afternoon, everybody. You're here today with Dr. Spider-Man. I just finished saving the train today, therefore damaged mask,
and it somewhat went like this.
And I also punched a few teeth out of Venom. That fight was crazy. Well, based on the information, I would like you to guess what's in today's genre. You probably wouldn't have guessed this, but it's root canal treatment. Have you ever wondered what happens during a root canal treatment? It is a procedure many people hear about, but only a few understand and some despise hearing it. Today, I will break it down step by step by using a 3D printed model that I have created for you. Many people think that the root canal treatment is the removal of the tooth. However, it is almost the opposite and is a process to save the tooth. This tooth would have probably been damaged by decay due to an infection. Inside every tooth, we have this thing called a pulp. This is a soft tissue containing nerves, blood vessels, and connective tissue. It is vital for tooth development. Why? It just is, especially during teenage years. Once a tooth is fully formed, it cannot survive without this vital component. When bacteria from deep decay or a crack on the tooth reach this pulp, they cause an infection to occur. Unlike a normal deep cut that you get on your skin, your tooth can't fight off this infection effectively. The rigid tooth structure means that swelling has nowhere to go. This chokes off the blood supply to the pulp, which is important for the development of the tooth. This leads to the pulp's tissue dying, and if left untreated, the infection can spread, causing pain, swelling, and even loss of the tooth. So how do we save the tooth? The goal of the root canal is to remove the infected or inflamed pulp, clean and shape the inside of the root canals, and seal them. Now we have the first step, the access and cleaning. Based on the X-ray, the image clearly shows where the infection has stemmed from, confirming the need for an immediate action with a root canal treatment. After the X-ray is taken, the dentist will go and immediately supply anesthesia to the main branch nerve to avoid pain. The second thing dentists do is that they remove the top material of the tooth to create a small opening using endodontic burrs. This usually happens on the top of the back teeth and the back of the front teeth. This allows us access to reach and clean the canals inside. Think of it like a small tiny keyhole to get inside of. The second step is the shaping and disinfecting. Once inside, we use tiny flexible instruments called endodontic files to carefully remove the infected pulp tissue. In this process, each canal is meticulously cleaned and shaped, but the files aren't enough on their own. We also use a few different solutions to ensure that the canals are thoroughly disinfected. First, the solution, like sodium hypochlorite, is used to dissolve tissue, followed by a rinse with saline. We also use EDTA to remove a smear layer of debris from the canal walls, and sometimes chlorhexidine as an additional disinfectant. The essential role of these solutions, also known as irrigants, are to break down necrotic tissue, eliminate bacteria, and remove the smear layer. These are delivered using syringes equipped with small gauge needles, often with side-vented or single bevel tips, to apply positive pressure and ensure the solution reaches and cleans the root canal system effectively. These syringes increase the wall shear stress in the canal, which improves the cleaning efficacy and mechanically removes more residues. After shaping and disinfecting, we use paper points to completely dry the canals before filling. Step 3. The filling of the root canals. Once the canals are cleaned and shaped, the next crucial step is to fill and seal them. This prevents any further bacterial invasion. We might use medications like clindamycin hydrochloride or a combination of a steroid like calcium hydroxide inside the canal to ensure it's completely disinfected before the final seal. The main filling material that we use is called the gutta percha. It is a rubber-like material perfectly biocompatible and is color-coded depending on the size of the canal. The instrument is heated and lightly touched to the gutta percha, and the gutta percha softens and takes the shape of the canal. We also use special dental sealer called AH+ to ensure a tight, impenetrable seal. This creates a barrier against future infection. Now we have reached step 4, the restoration. After the canals are filled, the access opening in the tooth is sealed with a temporary or permanent filling, also known as the coronal filling. Once placed on the tooth, it is exposed to UV light, which hardens the material. This procedure keeps being repeated until the tooth shape has been restored. But the procedure still isn't over. Because the tooth has undergone the canal treatment, it can become brittle over time, and a significant portion of its structure may have been taken away due to decay, and now it needs extra protection. That is why in most cases a crown is placed over the treated tooth. This acts like a cap, strengthening it and restoring its full function and appearance. Nowadays, it is becoming more common to use ceramic fused to a metal crown to restore the tooth to its original color. Overall, these methods will allow you to chew and smile more confidently for years to come. This is the jaw that has finally been restored. This is the tooth here, which has had a crown placed on top of it. Thanks for joining me on this dental journey today. I hope this demonstration has given you a clearer, more positive understanding of what the root canal treatment is. Remember, maintaining good oral hygiene and regular dental checkups will prevent issues like this from occurring in the first place. Well, see you. With great power comes great responsibility to floss. Peace out, everyone.